warn patients all the time that it's gonna take some practice to basically learn how to pee standing up. I wouldn't recommend going out in public and trying to do that as your first time, because the likelihood is that you'll have accidents, meaning you'll kind of wet yourself. And so practice at home, stand in the shower, and do this. Now, you're not allowed to pull on your penis because I don't want you tearing anything down there, but eventually once it's healed, it becomes second nature and you just pee like anybody else. The next major urinary complication associated with Metoidioplasty vaginectomy is stricture. So what a stricture means is that part of that new urethral tract scars for many different reasons, but it pinches off the urinary tract, and so it makes it hard for the patient to void, to pee, because they have to strain more, and because they strain more and they're not emptying the bladder as well, they have to go more frequently, and because of the urinary retention of not being able to clear your bladder so well, you're more prone to urinary infections. And so that's something that usually that we don't see right away, like fistulas. Sometimes that can take 3 months, 6 months, 9 months, maybe even up to a year for it to really present itself. And so our team follows you in terms of how you are voiding, so that even though things have gone really well, that it doesn't catch us by surprise further down the road. There are ways to address these major complications, but it requires at least one more surgery, if not multiple steps of surgeries to correct them. I'll address how to tackle these complications and how they are fixed, but it's a whole set of videos in themselves. Potential complications related to the scrotoplasty is mainly bleeding, hematoma, meaning a blood collection within the space of the new scrotum, or wound dehiscence, which means coming apart of the incision lines, because the skin flaps are made a certain way and sort of folded in like origami style. Sometimes that can be strained and lead to some wound breakdown. It tends to be minor and it usually heals quite well. The size of the scrotum varies from person to person, but again, another topic is scrotal tissue expansion and testicular implants, and so I'll save that for yet another talk. It's a lot of information. Another common question is, how does this affect someone who may want to seek other forms of bottom surgery, such as phalloplasty? And the truth is, it doesn't. You can easily obtain a phalloplasty by any means with a urethra, and it would be hooked up to the primary urethral lengthened portion. The sensation of the shaft of the penis and the glands of the penis is undisturbed with simple metoidioplasty or metoidioplasty with urethral lengthening. That's a quick and easy on a very complex transmasculine, masculine non-binary bottom surgery set of procedures. I hope this has been helpful. Please consult with your expert gender surgeon regarding this set of procedures. I'm your queer host, Zara. Please like and subscribe. Cups up, my queers. Bye.